what does everyone do when they come in? They're like, oh, I want a little bit less of this lower face, right? But I want to show you guys something. I'm 51, right? So I'm getting the laxity in the skin. Even if I just pull back like this, and I have a mirror to look in, but I'm assuming this is about right. If I turn to the side, what I want you guys to see is when we pull back with our fingers and we're simulating the lift that we want, what is going on here, right? A lot of extra skin. And that's why when you have a facelift, they cut the skin off and they throw it in the trash. So enter threads, lifting threads. The advertisements often say, get lifting threads. You don't have to get surgery. Just put threads in your skin and you'll lift. And you see these amazing before and afters. And it's like, oh my goodness, that's what I need to get. You call the office, it's like $2,000, $3,000, sometimes $5,000 for lifting threads. Now, I am not saying don't get threads. We have threads here at Medical Rejuvenation, but I broke some open so I can show you what they actually look like. So I don't know if you can you see this? Maybe on my pale forearm. So this is an 18 gauge trocar that the thread is put in the middle of this, right? And it looks like this. I don't know if you can see this. Can you see that tiny little thread coming out? And it's channeled through this little metal straw. And what's gonna happen with that sharp edge is when they put the thread in, and we've all seen these videos, if you've looked up threads, where you put an entry point and this is channeled down into the face, this entry piece is twisted off, put to the side, this piece is taken out of the skin, and the thread stays in the skin. Then you'll see on the video where the injector will take that thread and they will pull. And they'll say, look at all of this lifting power on the thread, right? We've all seen that. And we all think, this is a miracle, this is amazing. I don't have to have surgery, just put a thread in my face. All day long I would do this if it would take this and it would do that. If we could do this, I would do this. I'd figure out how to do it on myself. I'd have someone else do it for me. Here's the problem, you guys, is that when you put the threads in, so we're lifting, then we take our little scissors and we snip the end of it so the end of the thread goes back into the tissue so you don't have a thread sticking out of your skin. So I want you to ask yourself this. If you have a thread that's lifting, right? Where is this extra skin? So every before and after picture that you look at when they're like, oh my gosh, this was my before I had the threads. Then I got threads done and oh my goodness, my skin is so tight and beautiful. That's amazing. I want you to ask yourself, where did all that skin go? Where did it go? We're not suturing the threads. We're not tying like we have a laceration. We're not tying a wound closed. You're not ever tying the suture to anything. It literally, once you snip it, that thread just rests back down in the tissue. Now you'll have some inflammation, so you might look a little bit tighter because you have a little inflammation, but then you're gonna go home and you're gonna eat food and you're gonna talk and you're gonna do who knows what else with your mouth and you're gonna move your jaw down, and little by little that tissue under your skin is gonna detach from those little wisps of thread. And that thread is just gonna sit there and all the skin is gonna be exactly where it was, because skin unfortunately does not magically disappear. I wish it did, but it doesn't, right? So then you're gonna go back and you're gonna get it done again, or maybe you're gonna call them and you're gonna complain, or they're gonna be like, well, just wait 6 to 9 months. And once you wait 6 to 9 months, all of the collagen that's produced from the threads is gonna look beautiful. So just hang in there and call me back, Susan. In 9 months, call me back, Susan, and tell me if you still don't like it. Okay, so what it actually does, you guys, let's break it down. What does the thread do? When you have this thread that is in your skin and the body is trying to break it down, it stimulates collagen as it's breaking it down. So let's talk about other treatments that would cost you less money for stimulating collagen. Because if bottom line, what the threads are doing is stimulating collagen, which is what they are. They stimulate collagen, you guys. They are not lifting tissue. They're not sutured to the skin. We're not cutting off this extra skin and throwing it away. They're stimulating collagen, which is great. That's good to do. Okay, we've got microneedling, right? We've got a Rejuva-Pen, all tiny needles where we're creating micro injury that is always gonna stimulate collagen, right? New protein, new cell growth. We've got Sculptra, which is same thing as a thread, but in a powder form that we're gonna mix with sterile water. We're gonna inject and spread through the face and then massage so you get stimulation of collagen everywhere. So if all three things are going to do the exact same thing, which is stimulate collagen, not lifting, then look at the price of them and make your best decision based on price. Because why would you spend $3,000 to $5,000 on a thread that's going to do the exact same thing that $800 of a vial of Sculptra is going to do? Or you could get 2 vials of Sculptra for $1,600. You could get that done twice in a year, 4 vials for less than you're going to pay for 1 treatment of a thread. Or microneedling, arm microneedling, $400. You know, maybe some places are more expensive, but shoot, $400, you get 3 treatments a year on your eyes, on the side of your nose, around your lips, your jawline, preauricular area, temples, forehead, the whole shebang for $400 and great collagen stimulation. Where threads, you can only do it in a certain area. So all I'm saying is that with all the treatments and aesthetics, I'm not saying that it's bad or that you shouldn't do it or, you know, you made a bad decision if you did it. I'm just saying money doesn't grow on trees. So unless you just have an unlimited source of money and you just don't care what anything costs, make sure you know what the treatment is doing and then make your best decision for that treatment. And one other thing I want to put in there, you have to think about cost. You also have to think about downtime, because most of us are working or we're involved with raising kids, families, community. So remember with threads, you guys, this is not no pain, okay? I've done many procedures of threads and I am telling you it's not no pain. Now we use lidocaine, so it helps with the discomfort when that thread is going in. But trust me, if you're getting 3 or 4 of these, sometimes we've even done up to 6, right in the face, sometimes in the forehead, sometimes in the neck, jawline, you're gonna be uncomfortable. You could be uncomfortable for up to 2 weeks, okay? Very bruised, very swollen. So you need to think about that as well. And there is the risk that a little piece of your soft tissue of your cheek gets caught onto one of those wisps of the thread and it just gets stuck on there, so that when you're smiling and you're talking, you have like a little piece of skin that's dimpling. Or if the injector puts the thread too close to the surface, sometimes you can actually even see it. You cannot get these threads out of your skin unless you fillet your face, open up the skin and pull it out, which no one's doing. So you just have to wait until your body breaks it down, and it will eventually break it down. Sculptra, there's a risk of nodules. We know that. It's not that uncommon. You get a hyperstimulation of collagen and you can get a nodule in your skin. You need to be aware of that. Microneedling, very little downtime, very little risk. Your whole face, hydrate, gentle oils, hyaluronic acid, and within a couple of days, your face is just beautiful and glowing and gorgeous. So let's make sure we're making the right choices with our money and you're really getting the results that you're looking for when you book an appointment.